everybody. I am waiting on our guest of the week. This is Denise Ryan with Celluma Light Therapy, and I'm waiting for our very special guest, just watching for him to jump on here. It's Joshua Ross from Skin Lab USA. So I'm waiting for Joshua to join us and share his story of celebrity and fame in Los Angeles. Hi, Jen. So it should be a really interesting. Hi, Catherine. This should be a really interesting conversation. I know I'm personally really looking forward to speaking with Joshua. He has a great following and a very exciting clientele, and he loves Saluma, so we're going to learn lots of tips and lots of information. I just see him jumping on here. Just waiting for Joshua to join us now, and then we'll introduce himself. There we are. Hi, Joshua.
Hi. How are you?
I'm super. Nice to see you.
Let me get myself in the frame here.
Pardon me?
Let me just get myself in the frame.
Yes, get into the frame, and I'm thinking I might add a little light on the subject here. Let's see how this looks. How's that? Better or worse?
Great.
Okay.
Awesome.
So let's introduce ourselves before we jump in. I am Denise Ryan. I'm the Vice President of Brand Management for Celluma Light Therapy. Our global headquarters are based out of Southern California. And we sell Saluma globally and are legally registered as a medical device in 78 countries and counting. So, Joshua, you're just up the road. Tell us who you are, what you do, and where you're located. Let's hear about Skin Lab USA.
Great. My name is Joshua Ross, and I live in Manhattan Beach, but my practice is in Brentwood. I started Skin Lab in 2014. My background is really in plastic surgery, working for plastic surgeons, and I felt like there was a really big disconnect between the non-aesthetic or the aesthetic services versus the plastic surgery. So we offered these great non-invasive treatments, but not everybody wanted to be in that environment of plastic surgery, right? So what I wanted to do was bring all of the best non-invasive treatments that you can get at the dermatologist or plastic surgeons and bring them into a more accessible, holistic environment. You know, when I talk about non-invasive treatments, that really means causing your own tissue to regenerate and heal either through controlled injury, like chemical peels, radiofrequency treatments. And the thing that I love the most about the Saluma, it really is the only medical grade, non-invasive treatment that doesn't work through controlled injury. So the majority of things we do in a non-invasive practice mean controlled injury. So radiofrequency, for example, is a thermal injury causing your body to react and create growth factors and all of that. But the Saluma is very different because it really has no injury component to it. It's all about cell regeneration, causing the cells to function properly. And that really goes so well as such a complement to all of the other treatments that we do because they are causing a small amount of injury. So the Saluma is going to allow you to heal and get the results quicker from all of those non-invasive treatments.
You nailed it. I could not have said that better myself. When I started to learn more about your philosophy, I knew that this was a match made in heaven because it only enhances the cell's ability to heal and regenerate. That's all it does. People often think that it's more complicated than that, but sometimes we say that if you've never heard of the elixir called water, you might be surprised to find all of the benefits to the human body by drinking water and staying hydrated. And honestly, when you have a well-designed, well-engineered light therapy device that uses the correct wavelengths at the correct power output and designed to optimize how much energy is absorbed by the body, the result of that is similar to drinking water. It's strictly therapeutic and can dramatically enhance the under-functioning cell's ability to function more optimally. So,
and you can't have too much of it, just like water, you know?
Yeah, right, exactly. So, yeah, you said that beautifully, and thank you for sharing that because When I say it, I always say it the same way. And then to hear you say that, it's just echoing my words, but in a different way. So I'm sure that lots of our viewers will really enjoy hearing that,
Yeah.
that
Well, I think one thing that
take.
I find a lot like currently right now is people are being inundated with so many different products, so many professional treatments that they can do at home. I get somebody that books a consult, they come in for their first visit and their skin is just inflamed. It's red, it's blotchy.
Overdone, right?
Overdone, over exfoliated, over
Yeah.
anti-aging, over anti-acne, just overdone as a whole. And a lot of times they want to do all of these therapies and treatments, but they're just not a candidate for it because I'm already seeing this inflammation in the tissue. So that's the person that right away we're going to start them on a boot camp with Saluma. We'd love them to come in at least 3 times a week, 30 minutes. If they can come in more, great. But at the very minimum, it's hard to get that time commitment from people.
Right.
So I say if you can just commit 3 times a week, 30 minutes each time, we do that for 4 weeks. The change that they will see in the skin, a lot of times, unfortunately, I've lost that client to get another package of something because they're just so happy with their skin. But they always come back, right? Because we never stop aging, unfortunately.
Yeah.
Another thing, I think, especially when it comes to acne, you know, if somebody's coming in to see me for acne, it's usually a girl in her late 20s, early 30s. She never had acne before, and now she's just got acne all over the chin and jaw area. And what she's doing is she's treating it with over-the-counter acne products, which are really geared toward a different form of acne, right? That's geared toward teenage acne, your salicylics, your BHAs, your AHAs, and not to say that they don't have a place in skincare, but when you have inflammatory acne, it's not the same. So you need to do something different. And that's why I love the Saluma again. The blue light is going to help, but the red light really helps too reduce the inflammation of the acne. And a lot of times I say just go off of all of your acne products, stick to a very basic routine, a good cleanser, good hydrator, and great sunscreen, add on the Saluma. And a lot of times that will resolve the acne in 4 to 6 weeks.
Yeah. We hear that all the time. So we're not surprised to hear it, but oftentimes I think people don't realize that it could be as easy as that, and that a situation could be resolved inside of 4 to 6 weeks. Not that it always is, but it frequently is. And I like what you said there about a lot of times for decades we've heard about the importance of blue light for killing the acne, the bacteria that causes acne. But what I think people are only learning more recently is that combining the red light, because the acne program has almost equal emission of the blue, mostly blue, but almost equal emission of red as well, is that the red is acting on the other components of acne, knocking back the inflammation, knocking back the redness, increasing blood flow to bring more nutrients and more oxygen to the area, generating new, healthier tissue, helping those keratinocytes to generate better skin tone and texture. And that's all part of the acne healing process.
Right. Just again, causing the skin to function properly, right? And, you know, a lot of times people book a facial when their skin isn't properly functioning. And I always say that facials maintain the health, quality, and function of the skin. But if your skin isn't functioning properly, a facial's not going to help that, right? It's going to make you feel good for a couple of days. Your skin might feel softer. You might have a nice glow, but very quickly, it's going to go back to the way it was performing before, and they're going to be discouraged. And the problem is the investment in the money and the investment in the time. You know, when you're going into Sephora and you see this product for $70, which is a lot of money for me, for everybody, but it's touting all of these benefits, you're going to purchase it instead of purchasing a package of Saluma, which would be a little bit more upfront, but long term, you're actually going to change the way your skin is functioning, as opposed to this product, which again, 9 times out of 10, I find that they just cause more irritation and inflammation, especially for adult acne.
Right. I think what you're saying is that we need to get the skin healthier at the cellular level, and then work on the enhancements, of which I'm sure you have loads of ideas and
maintenance. It's right. It's maintenance. So there's correction, there's maintenance, and there's prevention, right? So we have to work on the correction first, and then we maintain, and then we start to prevent for aging and things coming down the line. And that there is a place for topicals and at-home skincare routines. But again, with Instagram, there's so many unqualified professionals on Instagram, and they're really doing these 12-step treatments, you know, with all of these products, and they're doing it for the content. They're doing it because it engages people. It's great to look at, but it
can be misleading. It can be misleading and
not scientifically
dangerous.
proven. Yeah, it's not scientifically proven.
Yeah, one thing I would say to all of our listeners, your listeners as well as our viewers that are listening in today, is that use the online platforms with caution. But when you really want to know about a product or a service or a practice, connect with the expert. Go directly to the source to get the information. We actually have a robot system that answers most of our questions. And I'm sure you get the same thing happens with you, but we get very highly technical questions posed on the likes of Instagram and Facebook and Pinterest all the time. And it's like, these are not questions that have just got a simple answer a lot of times. You really need to connect with a specialist so that specialist can understand what your concern is and then help point you in the right direction. So I think that's a very valid point and a serious point that you raise, to be careful of, you know, the I won't call them charlatans, but there's people definitely out there that don't know, but place.
I think they honestly have the best of intentions.
Yes.
They want to, you know, show their audience new, different things and therapies. And honestly, when you're 18 years old, your skin is functioning amazingly, you've got youth on your side.
Yes.
These things aren't going to show up immediately, the damage that they're causing to your skin, just like the sun damage that we get, right?
Sure.
Because we're young, you don't
doesn't show up till later on.
Exactly. So all of those, you know, at home professional peels, you know, with crazy amounts of acids that I don't even use necessarily in the office. We don't know what the pH is of them. We don't know if they're buffered or not. But one thing that I've done, and especially with COVID, I've had a lot more time to launch some online platforms. And what I've done is I've created a virtual consult. So if you go to my website, skinlabusa.com, you go to the booking tab, there's a virtual consultation option. There's no charge for that. And I can go over your skincare. I have an e-commerce boutique with some curated skincare that I truly believe in. And I can help kind of digest some of those things. You know, you don't have to have a 12-step routine. Start with 3 to 4 steps. Once your skin is really loving that, then you can start adding, then you can start layering. And the important thing when you're doing that is that you're going to know if it's working or not, right? Because you've already got your base core routine. And so if you add on a serum, if you add on a mask and your skin responds, well, great, add that into the routine. If it doesn't, exclude it. And so many times I have a lot of clients with Saluma panels, and they, you know, I'm always like, go back to the Saluma. Like, they send me these products, their skin's going haywire. I'm like, have you been using your Saluma? No, I haven't. Okay, well, let's go back to
the basics.
Let's go back to the basics. Let's go back to the foundation and then go from there.
So I have a question for you. Can you do these online consults with people outside of your geographical area? And can you help people if somebody, because we've got listeners, I'm sure, from all over the country, maybe all over the world listening today, can you have meaningful consults with somebody that may never be able to get in to see you in person? And do you encourage that?
Absolutely. And, you know, it is my time. So I do encourage you, once I prescribe some products from my website, obviously, of course, I would love for you to help a small business and purchase your products directly through me. And one thing that's really important that I want to bring up about e-commerce, because a lot of people are doing e-commerce right now. And a lot of people are shopping online. And there's these big box online retailers. I won't name any of them by name because I'm not trying to discredit anyone. But the problem with that is they purchase these products at such a high volume to be able to give a discounted price that the shelf life and the time that these products are either in a hot warehouse, they're in transportation. When you're really using efficacious ingredients, you want to get those directly from the manufacturer or someone like me who is working directly with the manufacturer. So I've made a commitment to order small batch orders. I don't order more than 6 to 12 SKUs at a time. When those are out, I order the next. So you're really getting a lot more bang for your buck because especially your vitamin C's, your antioxidants, they're so unstable.
They are unstable. So you don't really know what you're getting. So I think that's a very valuable and important point as well. Thank you for sharing that.
And what better thing to do right now in the age of COVID than help your beauty professionals? I mean, they help people so much in their day-to-day lives. Your hairdressers, your cosmetologists, estheticians. Yeah. Reach out to them. Ask if they have an online platform to sell products. If they don't, encourage them to do that. It does take effort up front. And, like I said, we had a lot of time at the beginning of the quarantine. So I was happy to launch that. And what I've tried to do is really simplify it into 4 steps. We've got cleanse, hydrate, protect, and target. I feel like everything falls into those. You don't need a separate category for toners. You don't need a separate category for serums. These products are doing all of those things together. So I've kind of just tried to simplify and curate. And if I carry a skincare line, I don't carry every single product from that skincare line, right? There's only, 2 cleansers, 1 more foaming, 1 more creamy and hydrating, things like that, kind of just simplifying things.
I am definitely going to have a consult and purchase skincare products from you after that. That's exactly, I'm a very busy person, and I would love to have the ability to have the expert advice and then purchase the recommended products, because I'm not a skincare expert. I'm a light therapy expert. So having your guidance and having it as simple as you telling me what I need, and then maybe we have a follow-up consult down the road. I think that's fantastic. I would love that.
If you have some time, I did reach out on Twitter earlier this week, and I asked if anybody around the world had any questions about Saluma, and there was a couple questions, so I want to go right to
let's do that
for those.
Yeah, let's do that.
A question I get a lot is products or no products when you're using your Saluma. I have my own philosophy and thoughts, but I want to hear yours.
Okay, what we recommend. Well, as the manufacturer, we follow the science to the letter of the law. So all scientific research is basically done on clear, dry, bare skin. And if you think about it, it's almost simply common sense. The moment you put anything on the skin, it does have the potential to act as a barrier. I would say, however, for professionals, maybe not for home users, but for professionals, there are some exceptions. A hyaluronic acid following microneedling, that's just fine. It's clear, it absorbs quickly. But anytime you see the obvious things are masks that are opaque, charcoal masks, mud masks, the thick jelly masks, the light, you're just going to block the cell's ability to absorb the light energy. So you're really wasting your time, and you're wasting your clients' time and money if you're using them in conjunction with any light. It's not just Saluma, but any light therapy device. So you don't want anything shiny, oily, or reflective, or opaque. So that's our stance on that. We want to maximize the time under the LEDs so that the client gets the biggest benefit from this session.
And I think too, immediately following your treatment, that's the time to really layer and lather on all those serums. Your skin's going to be better prepared to absorb them because, again, your skin is functioning better. And it's going to be functioning its best immediately after. So adding those then.
100% correct.
Great. Another question that we had is there's a few different Saluma panels, right? So there's the Pro, there's the Skin. And one question I get a lot is, why not use the pain setting for the skin? Because the people at home feel like that's the strongest, the modality of the panel. If you've got acne, you've got wrinkles, and you've got pain. Okay. So what are your thoughts on using pain for the face?
Good and very interesting question. So if you have a 3-mode device like your Saluma Pro, Joshua, your middle program in the USA is labeled Wrinkles. In other parts of the world, it's labeled Red Light because we have different clearances in other parts of the world. But really, you should think of that Wrinkle program as your skin program. But my favorite thing about that particular program is that while it's dominant in red light, it has almost equal emission of the near infrared and the blue. So it kind of can take care of a broad spectrum of issues, including pain to a certain degree. What a lot of people are confused about is the near infrared. Because we've had saunas and infrared heating lamps for decades, people think that the near infrared, not everybody, but some people don't realize that the near infrared is actually completely different than the far infrared that's used in saunas. That infrared in the saunas and the heating lamps, it doesn't penetrate into it doesn't have the ability to upregulate cellular activity. What those saunas do and the heating lamps do is they emit thermal energy. So they have more of a detoxifying effect on the body, which is therapeutic. But it's not doing what we're talking about. It's not reaching into the mitochondria, helping the mitochondria increase ATP production, which helps any cell that is affected to perform more optimally. And only wavelengths between the blue and the near infrared spectrum can do that. So that's sort of a sidebar. So getting to your the question on why can't you use pain, you could use pain. As a 60-something-year-old, I actually do choose to use the pain program because the near infrared that we use, along with the red, those two wavelengths upregulate very, very similar cells in the dermal layer. But the benefit of the near infrared is it can reach even a little deeper into the muscle and joint tissue, the subcutaneous tissue. So it's, for me, that has deeper wrinkles, I like to reach as deep as I can to help the tissue at the deeper level. So you certainly can. It's just that the red program, it doesn't do anything more than the red program for skin issues. It may just reach some of those cells at a deeper level. So
Great.
it would be okay. But the red program, the red dominant program, is really fantastic because if you have any kind of an acneic component to your skin, it will take care of that as well because there's so much blue in that red program. So when in doubt, I always tell people for skin issues, just use the wrinkle program. And if you think you need to reach a deeper level, then even though we call it the pain program, it's almost deeper skin.
Amazing.
That
We
makes
did
sense?
have a question here from one of the viewers, and they said, can it help with migraines? I'll leave that to you.
Oh, so that is a very interesting question. So because we're not FDA cleared and no LED device is FDA cleared, even if it could help with migraines and we knew for sure it did, we would not make a claim to do that. What I can tell you from more personal experience and interacting with a lot of different kind of practitioners, acupuncturists and different kinds of pain practitioners, and then the holistic wellness practitioner, we've a lot of them just like you. They want a more holistic, natural approach, something that's helping this body heal from the inside out. I have heard from them, and of course this is not science, a scientific response, this is more of a observational response. Headaches, to get to the root of migraines can be very complex, and a lot of headaches and migraines are triggered by digestive disorders. And sometimes we've heard wellness practitioners and acupuncturists treating issues in the abdomen with light therapy and sometimes in conjunction with other modalities like acupuncture. And when you resolve a lot of the digestive issues, sometimes if they're the cause of the migraine will go away. So it's a complex question with a very complex answer. You really have to
And I would always say try it. It's not going to hurt anything. You know, try it.
It's not going to hurt anything.
Feel like it, if you think if it's
right.
try it and it helps you, then
right.
it works for you, right?
And most people will think, oh, I put it over my head. That may not be the case. A lot of times, I even remind pain practitioners when using Saluma, you need to know the source of the pain. Where is it coming from? If you have sciatica, for instance, and it's paining down your leg and to your knee, there's no point in putting Saluma over your knee or your thigh. That's not where the source of the sciatica is coming from. You need to put it over the foramen where the sciatic nerve is coming through the hip joint.
Great. We did get another question here.
Okay.
Can you use the Saluma face panel daily? I think we went over that, but we can definitely reiterate.
Okay, you can. It's sort of what you just said. You won't do any harm. It's really almost impossible to overdose with light therapy. And the reason for that is it's really only affects your cells that are under functioning. And if your cells happen to get to 100% of their functioning capacity, then just like vitamin C, when they don't need the vitamin C, your body naturally flushes it out. So if your cells are performing at 100%, they don't even really absorb the energy because it doesn't need it. I would say there might be the rare exception that somebody might be very sick, have underlying conditions, and be maybe knowing they have or not knowing what their underlying conditions are, and they might be very sensitive. While you don't normally feel anything when using Saluma, it is a very powerful device. So if you're noticing anything after you begin to use it, and you're feeling that you'll know if it's too much. And what I would say to people like that is move a little more gradually and build up. Your body naturally defaults to a state of homeostasis, and it will do that, but it might need, it's like somebody who eats just junk food. If you stop today and eat just lettuce and broccoli tomorrow, you'll probably actually feel worse.
Yes.
So you just make those changes gradually. So you'll know if you're on the healthier side, it's likely you can use as much as you want. But if you have a systemic condition and you're somewhat compromised, gently ease into this very powerful
Listen
modality.
to your body. Listen to how you feel.
Exactly.
Another question I get all the time is people wanting to use the panel without the eye shields because they want to get that boost around the eyes. Of course, the skin around the eye, it's very fine and it does tend to wrinkle. So why not be able to get the benefits around the eye?
Okay. So I would leave this up to the practitioner. We, as a regulated medical device manufacturer, we have to provide eyewear, and it's in our user manual that you must wear the eyewear. However, LED light therapy is not laser light. It's not being delivered in the same manner, so it will not harm your eyes in any way. However, I always advise practitioner to use best practices and to offer, and if your client or patient refuses, maybe have them sign a waiver because you don't want to get into litigation down the road. But if you look at the mechanism of action and how light therapy works, it really cannot do any harm when used correctly. Now, if you are have a history of seizures or epilepsy or some of the other contraindications, then even eyewear will not mitigate the issue. So don't use it in those instances. So as a practitioner, I advise you to use it. Personally, I've used Saluma since 2012, and I've never and would never, for me, use anything over the eyes because I want to get these areas.
Great. That does remind me of something that I did want to call attention to. LED therapy is extremely popular now. It's popping all over Amazon. There's so many face shields.
Yes.
And I really, really discourage people from purchasing those. And not that I think they're going to do harm, but they're not the right frequencies. If you're not using the right frequencies, you're basically like putting your face up to an LED television. It's not going to do anything.
Right.
So, there's very, very few companies. Saluma, I think, is the gold standard. It's better to save your money, put it in a piggy bank, and, either go in, so we offer packages. A lot of times we'll offer complimentary LED therapy as an add-on to other treatments. So, do you guys have a patient provider locator on your website?
You know what? We don't. And as strange as this sounds, the reason we don't, we investigated it on and off over the years, but we sell so many devices every week and every month that there wasn't even an app that could help us add those people at the rate and keep it up to date. So we never did that. And every now and then I investigate to see if there's a new way. But what I usually tell people is if you use your Instagram or use your Facebook or use Google in your area to find practitioners, you can usually find, if somebody Googles the area, they're probably going to find you. But yeah, we don't offer that. It's just, I remember thinking
people
I would
reach
need
out
two
to you
people.
directly on your Instagram. I'm sure you can find referrals to help them. We do have a couple more questions before we end our live. So is Saluma good for tightening or collagen boosting? And at the same time, I'll ask the second question, which is when using the Saluma Pro, what is the optimal setting while doing microneedling and facial acupuncture?
Okay. Oh, fantastic. Okay. So, what was the first question again?
Is it good for tightening or
Oh,
collagen?
yes. Oh, yeah. I mean, one of the main benefits of using red light therapy, which is dominant in all of our programs, is that it helps the fibroblasts generate more collagen and elastin. And it does this really, really well. And so that doesn't just help with skin issues, but that also helps with injuries. These are the two most common proteins in the human body and essential for skin tightening and fighting fine lines and wrinkles, but also for tissue repair, healing, recovery, injury following an accident or even surgery. So it is absolutely going to do that. And then the best setting for the microneedling or cosmetic acupuncture is that red dominant program, the middle program that we call Wrinkles in the USA. If you're based in the USA, it's Wrinkles.
Great. Thank you. Yeah, I would definitely say it's great for the whole family. You know, my husband has injuries and he loves to use it. The kids for the acne, you know, it's definitely, you know, something for everyone, whether it's, you know, teenager, young adult, older adult.
Yes,
It's good for
and
the whole
pet,
family.
and Joshua, even pets. Pets
If I could
respond.
get my dog to sit down still enough, I don't think he would do that.
So you mentioned your husband. Do you want to give your celebrity husband a little plug? I wasn't going to say anything.
Well, my husband did play in the NFL for 8 years. He played for the Dallas Cowboys. So needless to say, his body has definitely been through some wear and tear. And I will say he's very skeptical of these kind of therapies and these kinds of things. I think it's the age difference, perhaps. But once he did it, he's like, wait, it does actually feel better, you know? So he's a definitely believer, and he's always, can you bring the panel home on the weekend? So I need to probably just get a panel to keep at the house.
At home. Yeah.
Yeah.
And that's fairly common with partners that are not in the industry or not in a space like acupuncture or wellness or a medical aesthetics that have not been exposed to light therapy. It does look hokey until you actually experience it. So we always encourage people that are skeptical, just try it. And I think the most common feedback we get then is that not only did it work, but I was surprised at how quickly I felt a difference.
Right.
Yeah.
Another thing that reminded me of, speaking of my husband, he doesn't like to wear sunscreen. He likes to be out in the sun. He's born and raised in Manhattan Beach, so it's really, really difficult for me to do anything on him that involves intense peels or lasers or anything like that.
Yeah.
So anybody, they're just those people that just refuse to stay out of the sun.
Yeah.
So Saluma would be the #1 professional treatment that they could do for themselves. There's absolutely no contraindication. I'm always, as an esthetician, going to tell you to wear your sunscreen, but
Of course.
That get sun, Saluma would definitely be something to add into your routine.
So how did you get exposed to light therapy? Was Saluma your first experience?
Yeah, so like I said, my background is in plastics with plastic surgeons, and LED has always been a therapy that we've used for people post-surgery to help expedite healing. A lot of times too, you know, and by no fault of the doctor, by no fault of the injector, some people just bruise, you know, by nature, it's going to happen. Maybe they had, you know, a couple glasses of wine the night before, even though they said they weren't going to. And we would always use the panel as a way to mitigate that and for customer satisfaction to help promote that healing process. So I've seen, you know, it used in so many different ways. And that's another good point for professionals out there. One of the reasons I love having the Saluma is it's a great add-on to anything. Maybe somebody wasn't 100% happy with the outcome that they had. Maybe they felt like there was too much downtime. Whatever the case may be, it's always something in the middle of your day. You're booked with clients, you can put them on the chair with the Saluma, you can go do another treatment in the other room, and they're going to feel like you've done something to help with whatever they were concerned about.
Right. And I think the reducing downtime, a lot of people don't know that there actually is something simple to use, non-invasive, pleasant, a pleasant experience that can reduce the downtime even after those more deep deeply ablative procedures. So that's a very important point as well. Do you want to share anything else about Skin Lab USA that I mean, if it's your viewers listening, they already know, but if there's new people listening, what would you like to tell them?
We're based in Los Angeles, and you know, if you weren't tuning in at the very beginning, oh, we have somebody at the door. Hold on one second.
That's so funny. I was worried. I'm back at the house here, and I was afraid the electrician was going to show up. Joshua, I'm just telling our viewers, I was afraid the electrician was going to show up during the middle of this, and I was going to have to answer the door. But
so what I was going to say is that we're based in Los Angeles. If you're here local, we'd love for you to come in and see. But I really did try to help, you know, a broader audience by launching the e-commerce boutique. So if you're not local in Los Angeles, please visit the website skinlabusa.com. You can navigate directly to our shopping page, or you can navigate to the booking page to book a virtual consultation, and that will give you direct access to my calendar where you can book a 15-minute session. We can go over your existing skincare routine. We can talk about professional treatments, and we can also talk about some curated products that I would recommend.
I know for sure I'm going to do this.
Yeah, I'm gonna watch for that. I'm gonna watch for that consultation to get on my calendar.
Yes, I am going to do it, because for a person as busy as me, and I used to be on the road all the time, so I actually don't have a good routine. I don't see an esthetician regularly, but I want to, because I understand the importance of it. But it's just like, where do I start? But this is going to be wonderful for me. I'm definitely going to do this.
Great. Thank you so much for the time. It was really educational for me. And I hope viewers got this. And we'll save this so that people can view it for the next.
Yes, we'll definitely save it for sure. Joshua, this was fantastic. Thank you so much. And
thank you.
Yeah, have a great weekend.
From Los Angeles.
Thank you, everybody. Bye-bye. Be safe and be well. Thank you.
Bye. Thank you so much.
All right. Bye-bye for now.
Bye-bye.